Hi, my name is Heather Schmidt, and I'm a clinical social worker at the UCI Counseling Center. Today I'm here to talk about mental health, navigating the college experience, and how the UCI Counseling Center may be able to support you on your journey. The transition to college comes with it a lot of change and some stressors. These include becoming a young adult, managing emotions, becoming autonomous, figuring out who you are, interpersonal relationship changes, establishing and clarifying your purpose, developing integrity and values. These are all a normal part of the transition to college. They can be sources of stress and merit seeking mental health support. How each individual moves through these tasks is influenced by individual factors such as personality, history of experiences, our culture, and our worldview. So what are some of the common reasons that students seek support at the UCI Counseling Center? Here are the top 10. They include anxiety, stress, depression, academic, self-esteem, loneliness, relationship concerns, attention or learning concerns, sleep difficulties, and career concerns. The items coming up as highlighted as red show overlap with national reports of concerns of college students and why they seek mental health support on their campus. If you are experiencing any of these concerns, you are not alone. The Counseling Center is here to help. Later in this presentation, we'll give an overview of our services and how we can support you. You may be asking yourself, how will I know if I'm experiencing a problem or if a friend of mine needs support? Well, these are some signs or signals that you or a friend may need help. Note that not everyone will experience all of them, and experiencing one of them does not necessarily indicate a problem. But the more of these signs we see in ourselves and others, the more likely it is that we may be experiencing distress and need support. These include social withdrawal, difficulty with daily tasks, loss of interest in hobbies, difficulty concentrating, remembering, or thinking clearly, lack of motivation, dramatic sleep and appetite changes, deterioration in personal hygiene, rapid or dramatic mood fluctuations, and increased substance use.
You just heard of some reasons and some potential symptoms that students may experience and which may lead them to seek services at the UCI Counseling Center. Now we're going to talk about some potential barriers that may prevent you from seeking out help. Now we want to acknowledge this is not an all-inclusive list and that each person's experience is unique, but these are oftentimes some of the reasons that we hear why students may delay seeking help or never seek out help at the counseling center. And as we all know, there's still a lot of stigma around mental health and help-seeking behaviors. Oftentimes, students express feeling scared. They're not sure of what to expect from a counseling center or a counselor in general. How do I set up an appointment? And so then that feeling of being scared prevents them from seeking out help. They don't want to be labeled. As I mentioned, there's still a lot of stigma around mental health. And so those who may be experiencing some mental health concerns or symptoms may feel like they may be labeled by their family, friends, or the larger society. We don't want to be treated differently because we may think people are just feeling sorry for us because we're struggling or because we're seeking help, when actually it's not that. Like, people may be genuinely caring about you, and so they're showing support and emotion and empathy as you're struggling during a difficult time. We want to acknowledge that there's sometimes family and cultural values that may discourage us from seeking help. Maybe we've been taught that we're supposed to deal with these problems on our own, or that we don't tell other people our business. And we don't want to be shamed for asking for help. And as a result to some of these barriers, oftentimes 2/3 of students won't get the help that they need. So again, we want to acknowledge that there's sometimes a lot of uncertainty, ambiguity. There may be things that we've been taught by our families or the larger society around seeking help. But we want to encourage you, if that you're ever experiencing some of those symptoms that were previously talked about, that you know that the UCI Counseling Center is here. And a lot of times students feel a little more comfortable knowing that they don't have to commit to therapy by coming in for an initial assessment or for an urgent care appointment. Sometimes just getting a little more information or familiarity with the counseling center can help break down some of these barriers. Next, we're going to talk about some myths and facts around mental health and help seeking. So we're going to present some statements, and I want you on the other side virtually to guess whether this is true or false. So first off, counseling is only for people with serious emotional problems. Is that true or false? And if you guess false, that is correct. Counseling is for everyone, even counselors. Even we seek out help sometimes because we're human and we all deserve and have the right to be able to be supported, empathized with, and provided with resources and education. If I go to counseling, then my parents, professors, or friends will hear about it. Do you think that's true or false? If you guessed false, you are correct. Counseling at the UCI Counseling Center is confidential. So we're not going to tell your parents, your family, or your friends unless we have certain permissions in place, as well as there are certain limits to safety where we might have to breach your confidentiality. So if you're in danger of harming yourself or others, if your records are subpoenaed by the court system, if you report any abuse of a child or elderly adult, or if you're proven to be gravely disabled, we may have to contact the appropriate people to help get you connected to help and resources. Outside of that, we're not going to communicate with anybody unless you give us special permission to do so. Once I go to counseling, I have to go forever. Is that true or false? If you guessed false, that is correct. Actually, great things can happen in just a few sessions. Oftentimes, the students at UCI only see us for 2 to 3 sessions and see a resolution of some of their problems or learn coping skills that allow them to better be able to manage their symptoms. So again, just because you go to counseling doesn't mean you're signing up for counseling forever. And lastly, my counselor will tell me how to fix my problems. Is that true or false? And if you guessed false, that is correct. Counseling is a collaborative effort between the client and the clinician. Oftentimes, our role is to be supportive and provide resources, education to help you figure out and decide what's going to be best for you. And so it really is collaborative in an effort. So you may be asking yourself, how do I seek out access to mental health services at UCI? And here in a brief moment, we're going to show you a video that goes over how you contact us, what you can expect from our first session, and what you can expect from counseling. But one of the things we want to acknowledge is that right now, things are kind of up in the air of how things will look for the full academic year for the 2020-2021 year. At this point in time, all of our services are being offered remotely through telebehavioral health means, which includes video conferencing and phone sessions. However, we want to acknowledge that as the university complies with local, state, and federal safety guidelines, some of this may change over the next year to where we may be offering some services in person and be back on campus. But at this current time, it looks like most of our services are going to be offered remotely in the fall quarter. But we encourage you to stay up to date through our website or by calling our number at 949-824-6457 to learn more about our services and how we're currently operating. Here's a video, and we hope you enjoy it to learn a little more about how to seek out services at the Counseling Center.
I hadn't felt like myself in a long time. I didn't enjoy the things I used to. I just didn't know what the problem was. A few of my friends had suggested I see a counselor, but I shook it off, hoping things would get better on their own. While I knew they were probably right, it was hard to imagine myself in counseling because I didn't know what to expect. I didn't want to lie on anybody's big couch. And isn't counseling just for crazy people? Am I crazy? I'm not crazy. I wondered if the counselor would judge me or if my friends and family would find out. I tried talking to friends and family about it. I tried to make more time for things I enjoyed. But I knew something was off, and I really had no idea what it was or how to fix it. I even tried Googling some of my symptoms to see if I could figure it out, but as time passed, I was feeling worse all the time. It even began to affect other areas of my life. My grades even started to suffer. I finally accepted that everything I was trying wouldn't work. I needed something more. So I made the call. The receptionist was friendly and helped find time that worked with my class schedule. I thought I would be seeing someone right away, so I was surprised when she said there was a wait list. At first I thought that the wait was excessive, but after doing some searching online, I found out that it was standard procedure for most healthcare services offered at a university. It also made me think, hey, if there's a wait list, there must be a lot of people going to counseling too. I guess more people go than I thought. The receptionist said if it was urgent, I could come in right away for a same-day appointment. I considered my options and decided that I could wait. As the date of my appointment grew nearer, that's when my nerves really started to get the best of me. I started wondering, what's going to happen in the appointment? What will they ask me? Will they give me advice or blame me for causing my problems? I wonder if other people ever have similar issues, or is it just me? I didn't want to be judged by the therapist. What if they don't like me? What if I don't like them? Will they give me medication? Do I even want medication? I had no idea what to expect from counseling, so it made the wait a bit difficult. If you're considering counseling and not sure what to expect, take it from me. It's normal to be anxious. The day of my appointment had arrived. When I first walked in, I was asked to fill out some paperwork before meeting with my counselor. It had questions about my symptoms and my mental health and medical history. Then, a few minutes later, I finally met with Dr. S. Turns out, she was really chill for a doctor. After she introduced herself, she informed me that everything we were going to talk about would be completely confidential, with a few exceptions, which we discussed until I felt comfortable. She also said that if we see each other on campus, she wouldn't say hello if I didn't want her to, unless I initiated the communication. We talked about why I came in. I told her that I hadn't been feeling like myself lately, and I didn't know why. I talked about how I couldn't focus in school, how I was feeling sad and angry at times for no reason, and that I was exhausted. She asked me questions about my family, my friends, any clubs or organizations I was a part of. She asked me about my childhood, any medications I'd ever taken. She also asked if I had ever had thoughts about self-injury or suicide. That surprised me a little bit, but she said that asking was a common part of an assessment for everyone. My initial fears completely disappeared in the first few minutes. I felt so relieved. It was really comfortable to talk to her. I don't know why I was so worried. In the end, we discussed a lot of different options for what to do next. She helped me make a customized plan. For me, my plan included individual therapy with a counselor on campus. However, there are so many options. She let me know that if I didn't feel comfortable working with her, that I also had the option to work with another counselor. Dr. S and I are a good fit though, so we decided to stick together. My next scheduled appointment is a week from today. After I left, I thought about all the advantages of going to counseling on campus. I mean, they're experts. Basically everyone there has years of experience and training. I also thought about how all of my concerns were sort of off base. I didn't have to lie on a couch. Turns out, I'm not alone, and it has given me a ton of hope. Sometimes it can be challenging, but I know it's a process, and I should try to keep it going. I've now gone to 3 sessions. I've learned a lot about myself and how to better regulate my emotions. Dr. S provided things for me to work on in between sessions, and I am getting stronger every day. I'm looking forward to seeing what comes out of this. We have about 3 more sessions before we reevaluate my progress. So, that's how it works. Counseling works for a lot of students. Find out if it's right for you.
This is a typical story. Most students attend 4 to 7 sessions. Services may vary, but all campuses offer crisis urgent care, individual, and group therapy. Check with your campus for additional services offered. Most services are free for registered students.
The video you watched just highlighted what to expect from therapy. To access therapy services, you can contact the Counseling Center. The Counseling Center offers individual and group therapy services in addition to crisis and urgent care, psychiatric, and outreach and consultation services. We're currently offering remote services, and due to state laws and regulations, we are only able to provide services to individuals located within the state of California. However, if you are currently located outside the state of California, please go to our website and click on Services Outside of California icon for referral resources and information. On campus, the Counseling Center is located across from Starbucks and is open Monday through Friday from 8 a.m. to 5 p.m. And in fact, the Counseling Center is free for all registered students. Now, when helping a friend, oftentimes it's best to offer support by just listening to them and being there for them. And sometimes you might actually have more concerns where you might be afraid that they might be a danger to themselves or others, where they might have thoughts about harming themselves or others for any reason. If this is the case, call 911 or the campus police, and you can reach the campus police at 949-824-5223. Now, if you're not sure about whether or not they're having any thoughts of harming themselves or others, it's always a good idea to call the Counseling Center and consult with us. And you can just do this by, again, calling us for consultation, and our number is 949-824-6457. And the great thing about it is that you can actually still call us after hours, after 5 o'clock, or even over the holidays, and still consult with us, because we do have after hours option where you call our number, press option 2, and you'll be connected with a live mental health specialist who can just help you through and consult with you about what to do. And if for any reason you're not really worried about them being a danger to themselves or others, still feel free to refer them to the Counseling Center, because we're more than happy to help them. And as you're also helping your friend, you might just find that there might be other resources on campus that they might find helpful as well. And while you're helping a friend, it's also really, really important to remember to take care of yourself and for you to get that support that you need. So if you want to just come in for a session with us, please feel free to do so, because it's really important that you take care of yourself in this time. And in fact, if you're interested in getting some help, or maybe you just you're interested more in self-help resources, we do have something called Therapy Assisted Online, or TAO, which is an online platform that the Counseling Center has that's free for all students. And this online platform provides tools and informations to help college students learn about the struggles, the transitions, and any sort of potential difficulties that are common among college students. And this TAO platform might be really great, especially for students who are currently living outside of California, either if it's a different state or a completely different country. TAO has some really great videos, some interactive activities, journals, and even a library full of like mindfulness tools, so that you can kind of develop some skills and strategies to help you be successful academically and socially. And you can actually access TAO by scanning the QR code. Feel free to take a picture of it or just scan it with your phone right now. I would actually encourage you to start working on some of these great resources so you can feel better prepared to transition as you start adjusting to college in the fall. And the TAO app, there's an app for it on Android and on Apple, so you can access TAO any time of the day on your phone. And once you complete a profile through the online portal, you can just download the app and have access to all of the amazing resources that TAO has on its own platform. And if you would like to have more information, please connect with us online. Check out our social media pages on Instagram, Facebook, and Twitter, as we do post a lot of upcoming events on our page. And our YouTube page actually has some really wonderful videos We are building some mindfulness videos on there, as well as some quick tips in terms of taking care of yourself. So please be sure to check them out. And what you can also just do is you can even scan this QR code on the screen, and with this QR code actually will take you to like one of the pages where you can access just resources, quick resources about how to, for example, if you have questions about how to help a friend, or if you're looking for resources. And let me just show you what you'll be accessing in just a minute. So this is the page that you would access when you click on the QR code or you access the QR code. So for example, if you are worried about a friend, you have some resources that you can kind of look into about how to talk to them. Or if you are having some trouble coping with the situation yourself, you can access some resources there. And you will always be able to contact the UCI Counseling Center. And you can always just see in terms of how to schedule an appointment with us, or even in terms of emergency services, what to do. And our website is also a great resource. So when you go into our website, you'll just see that you can access our resources. And currently we have some really wonderful COVID resources we've put together. And you can just sort of see in terms of managing stress, or if you were interested in mindfulness and meditation resources. And we have a few self-care activities that we kind of recommend during when you're quarantining. So these are some resources that you can access really well and quick. And if you're interested in what kind of group services we offer, or any other short-term or therapy, what does that look like, you can always just check our website to get that information. So go ahead, connect with us online, and we look forward to seeing you all and providing you with services in the fall.